one of the biggest winners, right, of this election cycle is Medicare Advantage plans. In terms of there's a lot of opportunity for these plans to really sort of claw back some of the items that folks just didn't like. Think of the rate notice. Think of a lot of the more heavier regulatory things that we've seen trending from the Biden administration, sort of the undoing of some of the things that we saw in the first Trump administration. There's so much opportunity for MA plans to forge a new path, and a path that is sort of much more beneficial to them and their members than we've seen in the past several years.
And definitely reflected in the stock gains that we saw
Yeah, exactly.
immediately after the election, right? For United and Humana specifically,
Mm-hmm.
big jumps in their stock. So if we funnel down a little bit, so generally good, right? So from
Yeah.
a Medicare Advantage plan, if I'm the CEO, I'm feeling pretty good about this new administration and this change and
Mm-hmm.
what it means to my organization. If I'm the quality leader or the stars leader, how am I feeling?
I think you'd be feeling sort of cautiously optimistic, right? And the reason I say that is because as more time passes and we get more line of sight, and I know we're going to talk about RFK and HHS and all this in a second, but as more time passes, sort of we'll get more information as to who, RFK or the Trump administration more broadly wants to put at the helm of CMS, right? Right now, that is an unknown, right? RFK is a known entity, but a relatively unknown entity when it comes to things related to Medicare Advantage and quality, especially, right? And
Mhm.
so who he chooses to sort of carry out his vision, once he can articulate that vision, for something as not as sort of all the things that he says, as this MA is likely the least controversial, right? So how much airtime will it even get in sort of his bigger policy priorities? So this person will be really important. And so once we get a sense of who that person is, who they're vetting for that position, then I think the quality people will be able to say, okay, I have a roadmap now. Are we going to go down the pathway of sort of consumer protections, as we know RFK Jr. has been, championing for the majority of his career? Are we going to go down a pathway where, we're sort of listening to the more mainstream Republican voices, especially those on the Hill, who are more so trying to rein in or thinking of reining in Medicare Advantage as it relates to cost, right? And how that's going to impact quality and stars. Everything is tied together. And so I think that if I am a quality person, sort of, doing the work in a health plan, I am going to be cautiously optimistic, but eager for more information, and also eager to figure out how I can engage and help to shape some of the conversations that are going to happen.